From a social media standpoint, all seems to be well again at the Queen Elizabeth Hospital in Barbados. Almost 3 weeks after a cybersecurity breach crippled operations at the island's only public hospital, QEH's social media accounts have been actively updated with health tips, holiday scheduling arrangements, and even posts about the Christmas babies welcomed at the healthcare facility. What's been missing, however, is concrete information about the status of the recovery process since the December 11th cyber attack. Last week, Monday, Executive Chair Juliet Bino-Sutherland issued a one-paragraph update posted on the hospital's website. The update informed that the Barbados Ministry of Innovation, Science and Smart Technology had given QEH the green light to restore operations in 4 unnamed, quote, priority departments. This, Bino-Sutherland said, would, quote, alleviate the pressure placed on our medical services and accident and emergency department. The statement continued, quote, thanks to the support of MIST, our IT department and private experts, we have made progress despite the circumstances. In the 5 updates provided since the attack, the hospital has not yet disclosed the nature of the breach, how the systems were breached, whether the private medical information of hospital patients was compromised or exposed in any way, or whether there was risk of data loss. Consortium journalists have been attempting for several days to reach hospital officials to gain clarity and insight into the current situation, but have thus far been unsuccessful. Calls to the official listed numbers for QEH went largely unanswered. The one call that was picked up was transferred to another line which rang out. Contacting the hospital help desk led to our reporter being given the same official telephone numbers for the hospital, while messages to the QEH social media profiles remained unread for hours. An email to the hospital's listed help desk address bounced back with an error. The email address entered could not be found. Finally, just before 10 p.m. on Thursday, our journalist spoke with a telephone operator at the hospital who confirmed that appointments for services were still not being issued as a direct consequence of the breach. Officials were still waiting for systems to be functional again and had no timeline for when that might happen, we were told. Our request to speak with someone with knowledge of the IT recovery operations was forwarded to management for a response, which we are still awaiting as of press time. On Friday, local press outlet Barbados Today reported Dr. Christine Greenidge, Director of Operations at QEH, as saying that hospital functions that require the use of the internet will begin to be restored as early as next week, and that, quote, cleaning of the hospital's computer systems has also begun. As our reporters were informed, clinic appointments are still not being issued, with patients advised that the medical records department would be reaching out at some unspecified point in the future to provide appointment dates to those who have submitted paperwork manually. Friday's BT report made no mention of the origins of the breach, nor did it address data privacy and security concerns. Sources on the ground in Barbados have suggested to consortium journalists that operations at the hospital are in fact nowhere close to approaching normal, with wait times for services mounting, hospital staff in many departments still receiving and processing information manually, and major departments still crippled. However, a days-long effort to confirm or debunk this with information from official sources has thus far come to naught.